This video is a simulation of our COVID-19 emergency intubation checklist. We've developed our guideline based on both national guidelines and local expertise. Please note that this checklist will be subject to change over time, so please refer to the most recent available guidelines. The guideline consists of a number of steps. Outside the room, these include assemble team, prepare equipment, team brief and airway plan, prepare yourselves, prepare to enter the room. After entry to the room, the steps are pre-intubation checklist and post-intubation.
Just to recap the scenario, this is a 59-year-old gentleman who's come in with suspected COVID-19. He's got increasing oxygen requirements. His SATs are now 88%, and I think there's a consensus on ITU that we're going to intubate him, which we'll need to do with all PPE in place. I think Max has got our box, so we can start working through our checklist.
1. Assemble team and allocate roles.
Can we just all introduce ourselves?
I'm Anita, I'm a consultant anaesthetist, I'm intubator number 1.
Okay.
I'm Carolina, runner.
I'm Max, anaesthetic registrar.
And I'm Ellie, ODP.
Are you going to be first intubator?
I am, yeah.
Okay. I'm going to be team leader, I'm going to give drugs, and I'm going to be second intubator. And you're going to be our skilled assistant in the room, and you're helping with the airway.
Yes.
You're going to be our runner.
2. Prepare equipment. Consider allocating 2 team members to check airway equipment whilst the other 2 members start donning PPE. Assemble airway equipment using a call and response method with closed loop communication.
Get a face mask.
Face mask.
Okay.
Please refer to the full airway equipment list from the guideline.
We need to also get our video laryngoscope. And now we're going to get our drugs ready.
Next, draw up RSI and emergency drugs. For the purpose of this checklist, we recommend higher dose fentanyl with ketamine for a cardiostable RSI with rocuronium. In addition to normal emergency drugs, consider drawing up a dilute adrenaline.
Propofol infusion. We've got propofol that, and we've got for maintenance as well. Can you just check what's inside and just looking through the window without opening the door?
Check equipment list and clarify whether anything else needs to be brought into the room. Extra kit should not be handed directly from the runner to the team in the room. It should be placed unopened on the floor or on a trolley that can be slid into the room. Ensure the following are available inside the room or prepared to take in: monitor, cables, ECG dots, blood pressure cuff and tubing, end tidal CO2 modules, water trap and sampling line, SATS probe, water circuit, oxygen outlet, suction and tubing, oxylog ventilator and tubing, infusion pump, clinical waste bin and alka-gel. Also consider taking a nasogastric tube, central line, arterial lines and accompanying equipment as needed.
So now we're going to stage 3, discuss airway plan.
3. Team brief airway plan.
We're going to pre-oxygenate for 3 minutes. Would you like us to do cricoid?
Yes, we'll have some cricod to start off with, but if there's any difficulty, I'll ask you to take that off.
Okay.
Quickly.
So plan A will be our best attempt, video laryngoscopy with stylet. We're going to do 3 attempts for intubator number 1, and I'll do 1 attempt as intubator number 2. Plan B will be supraglottic airway, which we have here. Plan C will be 2-person face mask ventilation with adjuncts, which we have laid out. Plan D will be emergency front of neck access for difficult intubation. I will be doing the front of neck access if we need to. And other important points is we're going to inflate the cuff before we do any sort of ventilation, if at all possible. We're going to immediately connect the HME filter, and for any sort of circuit disconnection, we're going to clamp the tube. We're going to check that equal bilateral chest rise. We're going to check that with end tidal CO2 and with chest expansion. We're not going to auscultate. And we're going to connect then to the Oxylock. We'll make sure that we always have a HME filter connected.
Yes.
Excellent. So the next step is to get dripped up in our PPE.
4. Prepare yourselves. Please refer to current guidelines for donning for aerosolizing procedures. Important points are as follows. Don with the help of a buddy. Consider third set of gloves for intubator, as these can be removed after the tube is secured. Make sure you buddy check each other's kit. Ensure that you project your voice once FFP3 mask is on. Mask on first, take care with straps. Consider names on stickers for visors. 5. Enter room.
Any questions? Okay, let's get ready.
6. In-room pre-intubation.
Right. Can we quickly assess his airway?
Okay, so he was malventilated earlier and he's got normal fermental distance, good mouth opening, and
You've identified microthyroid membrane.
we've done that.
Okay. Prepare and check your water circuit and suction.
All we need to do is remember, check. On. The suction and water circuit already.
Brilliant. Let's check in pre-programmed ventilator settings.
I've done that already.
Okay. Optimize patient position.
Yeah, but I'm happy with this position.
Apply and check monitoring, including end-tidal CO2.
All monitoring is on. You can see it on the screen there. I'll just apply an antivirus. Okay, the
Okay, and we've got an eco pad for dirty air equipment. Can we ensure adequate IV access with fluid attached and running?
Got the 2 large balls for it, the fluid's running nicely.
Okay, right, so we're going to start pre-oxygenating now. Water circuit with HME filter.
Check. 4 litres per minute, so just stop. Okay, Ellie, can you tell me when, start breathing and tell me when breathing is good?
Okay, so what we're going to do is we're going to give the drugs, we're going to have 60 seconds of apnea, then we're going to perform intubation. Our first plan is video laryngoscope, we've got everything set up for that. And plan B will be supraglottic airway, plan C will be 2-person face mask ventilation, plan D will be front of neck access. Good. You let us know when the 3 minutes are over. I'm going to get the medication ready. Excellent. Are you ready?
I'm ready, I'm happy.
You ready? I'm ready. Brilliant. I'll give some fentanyl. I'll give some ketamine. And rocuronium is in. Time.
I'm going to control. Let me know when 60 seconds left. Good chest wall movement bilaterally, we've got misting in the tube. I can see that we've got some CO2 in our monitor. I'm happy that's in the right place, so can I put them hot, please? My ventilator's set and ready to go, so I'll have, before I disconnect and pop them on their monitor, I'll type the tube in.
7. Post-intubation. Ensure immediate HME filter application. Confirm correct ET tube position. Do not auscultate use end-tidal CO2 and chest expansion. Place dirty airway kit onto Inco pads, which can then be wrapped around the gyroscope blade. Remember to move your third pair of gloves. Ensure equipment is cleaned thoroughly before leaving the room. Doff PPE with extreme caution. Make sure you go one at a time and use a buddy system. It's important to be aware of space in the room and make sure that you do not contaminate yourself or others.